it's every month. Any other things we can do to protect?
So apart from the breast self-examination that she's mentioned, so there's also clinical breast examination.
Okay.
So you do yourself the examination of your breast every month, but also it's advised that at least annually, every year, you need to let a clinician or someone who has been trained do the examination for you.
So what was she asking?
So the breast itself undergoes some physiological changes, like she said.
Right.
So during ovulation, during your menstruation, the breast itself becomes a little heavier and becomes a little engorged. So it is advised that, so that one may be normal. So the examination you do should be after a week, when the breast is now seen to have returned to its normal state. Right. Then you can examine. It will be easier for you to pick up any changes in the breast at that time. So during your menses, it is not advised that you do the examination at the time, or even during the time you're ovulating, because there are some physiological changes that take place in the breast.
I see. Anything you want to add?
No,
that's fine. Okay, so let's talk about how we're dealing with it in terms of policies, in terms of whatever it is that policy. How is Ghana dealing with this?
So because of the geographical barriers in Ghana, for instance, so supposedly, if you get to know if the diagnosis or the impression is formed, where to get access to healthcare for the management is also another problem. Because, in Accra here, at least we have the chemo oncology, like radiation center, oncological center in Kolebu, that you can go there and then they will refer you. No.
Government?
No, government, not only Kolebu. We have some in Konfanoche and the Tamale Teaching Hospital.
No, here in Accra.
Here in Accra. Okay, we have some private institutions.
So the government institutions?
Yeah. So government institution, we have only one, which is Kolebu.
It's sad.
Yeah, it's sad because those in the villages and all that, if the impression is formed, they have to travel all the way
and come and form queue
to
the already existing patients or people who are here.
Who are already in a queue. And another thing is about the finances. It's not that cheap.
Chemo?
Yeah, it's not that cheap. The chemo, the radiotherapy, the immunotherapy for it is not that cheap. So that's also another issue that we are facing.
So how do we bridge this gap? Because you're not policymakers, though.
That is one of the role of family physicians. So we keep on advocating. So I think now National Health Insurance is doing well. At least some of the chemo medications are being covered by insurance. Initially, they were zero. So